That's the latest look at your weather. Guys?
Time now, 6:50, a new medical procedure using robots. I'd like to welcome in Dr. TeamCirisano from the West Boca Medical Center.
Thank you. Thank you.
Alrighty, and he's here to tell us about the DaVinci robot, a new device used in surgical procedures.
Very delicate procedures. Now, what's this device used for?
Well, the robotic DaVinci robot is actually used for surgeries that allow the surgeon to do the same procedure through a much smaller incision. Typically, the belly button can be used as the incision.
Are there complications with this robot when you're talking about surgery? That's a major thing, of course.
Well, surgery allows risks of all sorts, obviously, but the most important thing to acknowledge is that the smaller the incision, the lower the blood loss, and in general, a smaller incision allows you to have not only a shorter recovery, but also a shorter hospital stay.
And is that some of the benefits of it, as opposed to what?
Well, conventionally, an incision sometimes is in the range of 3 to 5 inches. If you reduce the incision to as small as a belly button incision, you can actually send the patient home the same day. And sometimes the patient can go back to work within 3 to 5 days.
And when you're talking about a robot, this must be very different compared to actually doing surgery with your hands. Tell us about that.
Well, a lot of comments have been made about that, both in clinical medicine and, of course, in the lay press. But the reality is, when you use technology to extend the physician's ability, you actually may improve the surgical outcome.
What kind of procedures are we talking about?
Classically, the most popular incisions and surgical applications include hysterectomy, ovarian tumors, uterine tumors, and prostate tumors.
And what kind of results are you seeing from using the robot?
Well, in general, a hospital stay can be in the range of 3 to 5 days for a conventional incision. When you reduce the incision to a belly button incision, if the patient goes home the same day, they can, as we said, go back within a week to work, and also their recovery time is reduced from 4 to 6 weeks down to less than a week.
Now, doctor, there are critics. This is from the Wall Street Journal. This is Dr. Paul Levy, Chief Executive of the Beth Israel Medical Center in Boston. He says, technologies are being adopted and becoming widespread based on the marketing prowess of equipment makers and suppliers, not necessarily on the public good. You say what?
Well, I think that no one is going to be able to stop the storm of technological advancement. And I think the important part of medical application is to recognize where safety allows us to deploy the instruments.
All right, doctor, we appreciate it. We'll keep an eye out for this new technology. Thank you so much for joining us here on CBS 12 Daybreak.